the South African Medical Research Council says it is temporarily suspending the Sisonke Phase 3B trial until further information is available. The MRC says it wants to reassure health workers who've already received the J&J vaccine as part of that trial that no incidents of blood clotting have been reported. Almost 290,000 health workers have received the jab in this country. We're joined now via Zoom by Professor Ameena Goga. She's one of the principal investigators for the Sisonke study for the Johnson & Johnson vaccine at the South African Medical Research Council. Prof, did I say your name correctly?
Yes, Goga.
Welcome and thank you so much for joining us. Should we be concerned?
Thank you. Sorry, you asked whether we should be concerned
about these developments.
Yes. Yeah, I think that they need to be noted. As part of any study, we need to note all adverse events. And if you look at what's happened and what's been reported with the J&J vaccine, we've seen approximately 6 of these events, thrombotic events associated with a very low platelet count. And we've seen 6 in about 6.8 million. So that brings us down to about 1 per million people vaccinated. So it is a rare event. We have not seen such events in South Africa. We've vaccinated so far just about 290,000 people, and we've not seen such events so far. But we are noting what has happened. We are reviewing our safety data and just temporarily pausing the study in order to allow SAPRA and the ethics committee to review all the safety data for the study. As a safety team, we do meet weekly, so we are on top of monitoring all events that happen or are reported into the study. So I think at this point in time, it's really extreme caution that we're taking so that people can review the safety data. If you weigh up the risks and the benefits, I think the thing to note is that the risk of getting COVID-19 is far greater than the risk of a thrombotic event, or the risk of dying from COVID-19 is far greater. So if you look at 1 million people who have COVID-19, about 30,000 may die. But if you look at 1 million people who've been vaccinated, and if you do the maths based on what was reported yesterday, 1 person may get a thrombotic event. So we need to review the risks and the benefits of vaccination.
It's important that you say that there hasn't been any cases in South Africa, but of course there's concerns if we could see situations where certain segments of the population who are most at risk of developing blood clots are told not to take these vaccines.
Yeah, I think one has to be careful because the vaccine is really designed to prevent mortality and severe morbidity from COVID-19. And it's the very people who have multiple risk factors, so smoking, obesity, cardiovascular complications. These are the very people who are at the highest risk of death from COVID-19. And so to say that we're withdrawing and not reconsidering whether they should take the vaccine then doesn't make sense, because if you weigh up the risk and the benefits of the vaccine, as I mentioned before, if you have 1 million people who get COVID-19, about 30,000 may die from COVID. But if you have 1 million people vaccinated and you do the sums, about 1 person may get a thrombotic event. And so we have to be very careful and weigh up the risks and the benefits and make sure that in any strategy we put out there, we're aiming to protect the most vulnerable in the population. In the Sisonke study, we made sure that we included everybody so that we could add to the data on safety. And I think thus far, as you've heard, we've had no such events associated with thrombocytopenia in South Africa, but we will continue to monitor as we move forward once the pause is removed and lifted.
So with all the data coming in, how do we separate the good from the bad? As you release these vaccines to a larger population, is it normal practice to keep on reviewing the data?
Yes, it's normal practice in any clinical trial. So as you know, Sisonke was a phase 3B study. So we're implementing this through a clinical trial. It's normal practice to have a safety team that monitors the data, and we meet weekly. And then it's normal practice to have an independent safety team. It's normal practice to be governed by ethics committees and the South African Regulatory Authority. And so what we're doing now is going through what needs to be done, given that there has been a noting in the US. And as we move forward, we will continue with these practices. When it comes to the national rollout, because I think that's one of the questions that viewers may also ask, what happens when a product is registered in a country? There still has to be post-marketing surveillance. And so that will then kick in when it comes to the national rollout. So it is really part of procedure, an important procedure too.
So the Sisonke trial has been administered to a demographic that ordinarily itself engages a lot with research and data. What sort of conversations are taking place within the health community, health practitioners community, in terms of the vaccines, its efficacy, its safety, and also the rollout process itself?
So I think there's a couple of parts to your question. So the first part is what conversations are taking place with regards to the safety. And so following yesterday's report, we have engaged with SAPRA. We've asked, we will review the protocol to see if any changes need to be made, any clarifications need to be made. There is a patient information sheet that each participant needs to read before they agree to participate in the study. And we will update that and add in this new information that has come through yesterday. For those people who have already enrolled, so you've already been vaccinated, we will put out a letter, a Dear Participant letter, to explain what has happened, to contextualize what has happened, and to present some of the data from the Sisonke study so far, so to present some of the adverse events. And so those are the type of conversations that we will have with healthcare providers who would like to be enrolled in the study or who have already been vaccinated on the study. In terms of the national rollout, I think that's the next step and another process. And I think it's important to look at all the vaccines that will be used in the national rollout to contextualize their side effects. And to contextualize them in general. Let's give this perspective, because if you're looking at 6 thrombotic events in a population of about 6.8 million who've been vaccinated, so approximately 1 per million, let's also look at the risk of thrombotic events from simple things like oral contraception use. So with oral contraceptives, 500 to approximately 1,200 in a million people are at risk, a million women are at risk of thrombotic events. Let's look at smoking. 1,700 and almost 1,800 people per million people who smoke are at risk of thrombotic events. So here we're looking at 1 per million for the vaccine. Compared with what I've just told you about oral contraceptives and smoking. And then let's look in particular at COVID disease. So if somebody gets COVID can actually cause thrombotic events. And so one needs to then weigh up the risk. We need to note what's happening, make sure we put in place monitoring mechanisms so that we can monitor, but then also contextualize the risks. And weigh up the risks and the benefits. And at the moment, the benefits of vaccination far outweigh the risks of COVID disease. And as I explained before, if you just look at the numbers, and if you compare it with the risks of oral contraception or risk of smoking, you see that the risk of such a thrombotic event through vaccination is very low. And so we need to then continue with vaccination programs when the benefits outweigh the risks.
I'm just interested in this. At the same rate that we're getting new data every day, we're coining new terms as well. And there's this new one about vaccine hesitancy. In South Africa, where the first rollout was for health practitioners, have you had a sense that some practitioners are hesitant to take the vaccine, but on the flip side, are also worried that if they don't take it, they will have missed the chance when the process moves on?
I think we expected that at the beginning of this study, but we've had such an overwhelming demand for vaccinations, and the vaccination sites have been inundated with people who are willing and want to be vaccinated. We've got unredeemed vouchers for vaccination sitting on the electronic vaccine delivery system. So we haven't seen vaccine hesitancy at that level. There might be vaccine hesitancy at other levels within the public. And perhaps that people who may not have access to enough information that helps them weigh up the benefits versus the risks of vaccination. And so advocacy and speaking about the benefits versus the risks of vaccination is very important. And comparing the risks of vaccination to the risks of things that we tend to accept in daily life. And I just gave you 2 examples there. I gave you use of the oral contraceptive pill, which is associated with a higher risk of thrombotic events as we've measured so far compared with the vaccine. And I've just given you the example of smoking. And so we need to get more information out there to the public. There's a concern that these vaccines have been developed rapidly, and yes, they have, in response to a global pandemic where all of us have gathered together to find a solution. And so the science that has gone into development of these vaccines have leveraged off science that has taken place globally over the past 10, 15 years around HIV vaccines, Ebola vaccines. And so, you know, there's a lot of experience that has gone into these vaccines and their production. And we need to get such information out there to the general public, particularly people who may not have a health background or medical background, and people who may not necessarily have access to information in language that they find easy to understand.
So with the suspension of the trial, what are the implications?
So we've halted vaccinations today. We had lots of bookings lined up in every province for vaccines, vaccine administration, and we've halted them for today. We had a meeting with the regulatory authority last night. We're reviewing the protocol, adding this information into the information sheet to make sure that everybody understands that this has been noted. We will meet again tonight with the regulatory authority, and thereafter ethics committees and regulatory authority will review the changes that we've made to the information sheet. We will put out a dear participant letter, and we're hoping that in the next 48 hours, maybe maximum 72 hours, we would have included this new information into the protocol and into the information sheet. And that we would then receive permission to continue with the study. So I think that's where we're probably heading.
So, and one imagines, of course, that you're working hand in hand with the department as well, just to get cues from the minister.
Yes, absolutely. Yes. The initial consultation and continued consultations are with the Department of Health and in particular the Minister of Health as well.
Yeah. Prof, thank you so much for speaking to us today.
Yeah. It's a pleasure. Thank you so much. Bye.
Professor Ameena Goga is one of the co-principal investigators for the Sisonke study for Johnson & Johnson vaccine at the South African Medical Research Council.